Aging often brings health challenges like high blood pressure, insomnia, pain, or bladder issues, and doctors prescribe medications to help manage these. However, many of these common drugs alter brain chemistry, and in seniors, the side effects are more severe because the brain becomes more sensitive and the body processes medications more slowly. Anticholinergics include drugs like diphenhydramine, dimenhydrinate dramamine, amitriptyline, oxybutynin, and even some over-the-counter sleep and allergy pills. These drugs block the neurotransmitter acetylcholine, which the brain uses for memory, attention, and learning. In seniors, frequent or long-term use starves the brain of acetylcholine, which accelerates memory decline. Studies have shown that seniors taking anticholinergics daily for 3 years had a much higher risk of dementia. This is one of the most dangerous categories because these drugs are often considered harmless. Drugs like Valium, Xanax, Ativan benzodiazepines, and Z-drugs like Ambien, Lunesta, Sonata are commonly prescribed for insomnia or anxiety. These drugs enhance the calming neurotransmitter GABA, essentially slowing brain activity to promote sleep. In seniors, these drugs linger longer in the bloodstream, leading to daytime drowsiness, confusion, and forgetfulness. Long-term use damages the brain's ability to form and store memories. What feels like a sleep solution often turns into a vicious cycle of worsening memory. Older antidepressants, particularly tricyclics like amitriptyline, have strong anticholinergic properties. Even some newer SSRIs, such as Paxil, may affect memory in seniors. These drugs can cause confusion, slower reaction times, and brain fog, especially when combined with other medications. While treating depression is essential, the wrong antidepressant can do more harm than good for cognitive function. Seniors often take them long-term, meaning side effects can build slowly and subtly until memory decline becomes noticeable. The challenge here is balance. The right medication can save lives, but the wrong one can accelerate brain aging. Opioids such as morphine, oxycodone, hydrocodone, fentanyl, codeine are used to control moderate to severe pain. They work by binding to opioid receptors in the brain to block pain signals, but they also dull other brain functions. In seniors, opioids cause sedation, slower thinking, poor memory, and confusion. They also reduce oxygen supply to the brain during sleep by depressing breathing, which further harms memory and brain health. Opioids should ideally be short-term only, but many seniors with chronic pain end up on them long-term, creating a dangerous cycle. Drugs used for urinary incontinence or overactive bladder, such as oxybutynin, tolterodine, solifenacin, are very commonly prescribed in older adults. Unfortunately, most of them are anticholinergic in nature, directly impairing memory. Seniors often report forgetfulness, confusion, and difficulty concentrating after taking these medications. Research shows that seniors on bladder anticholinergics have significantly higher chances of developing dementia within a decade. This is one of the clearest examples of a medication treating one problem but creating another, far worse one. Not all blood pressure drugs are dangerous, but certain beta blockers, propranolol, atenolol, metoprolol, and strong diuretics can trigger brain-related side effects. Beta blockers lower adrenaline, which in some seniors causes fatigue, depression, and memory problems. Diuretics, by flushing fluids, can also deplete essential electrolytes like sodium and potassium. Electrolyte imbalances often show up as confusion, disorientation, and dementia-like symptoms. Since many seniors take multiple blood pressure medications, these side effects often compound with other drugs, worsening cognitive decline. Older antihistamines, such as diphenhydramine, chlorpheniramine, and hydroxyzine, are widely used for allergies, colds, motion sickness, and even as nighttime sleep aids. These are also strong anticholinergics, which makes them particularly risky for older adults. Seniors using them frequently may develop confusion, difficulty learning new information, and worsening memory problems. Long-term use is directly associated with a faster progression toward dementia. While newer antihistamines are safer, many seniors still prefer the older, sedating ones, unaware they are harming their brains. Medications like gabapentin, carbamazepine, and valproic acid are prescribed for seizures, nerve pain, or even mood disorders. These drugs work by slowing electrical signals in the brain, which helps with seizures but also slows normal brain activity. Seniors often experience drowsiness, slower processing speed, and memory lapses. When used long-term, they can cause dementia-like symptoms and increase the risk of falls and injuries. They are powerful medications, and while sometimes necessary, they must be used very cautiously in elderly patients. Drugs like omeprazole Prilosec, esomeprazole Nexium, lansoprazole Prevacid are prescribed for acid reflux and GERD. While effective, PPs interfere with nutrient absorption, especially vitamin B12. Vitamin B12 is critical for nerve health and brain function. Long-term PPI use causes B12 deficiency, leading to confusion, poor concentration, and memory loss. Seniors are particularly vulnerable because B12 absorption naturally declines with age. What starts as a digestive aid may quietly contribute to chronic brain fog and dementia symptoms. Many of these medications are necessary, but seniors must weigh the risks against the benefits. The danger isn't always the drug itself, but long-term use, high doses, and combining multiple risky medications at once. The good news is, in many cases, drug-induced dementia is reversible. If a senior develops confusion, brain fog, or memory loss after starting a new medication, the first step should be to review all prescriptions with a doctor. Adjustments, safer alternatives, or lifestyle changes like sleep hygiene, physical therapy, or diet can often reduce or eliminate the need for these risky medications. Protecting memory and brain health after 60 requires awareness, caution, and proactive choices. By staying informed, seniors can avoid preventable drug-related dementia and maintain sharpness, independence, and quality of life. Thanks for watching the video.